A very good morning to you and welcome. Thank you so much for joining us this morning for House Calls, Real Docs, Real Talk. Now, we've got a very, very exciting show coming up for you today. And of course, we're going to be taking a look at some headlines. And our big topic today is getting back to seeing the doctor, going in person for those visits. During the pandemic, so many of us have probably put off any of our needs for going to the doctor and also the dentist. So what we're going to find out is just how safe is it to go to the doctor again. And it's very, very exciting because we have a very, very special guest with us today. And before we introduce him, I want to remind you about how you can be a part of the show. We want to take your questions and we definitely want to get your answers. So it's very, very easy. In fact, if we can put it up on the screen, just how easy it is to be able to see and hear all of the things we're talking about. There you go. To comment, we just have you text AHA Live. I know that looks like AHA Live, doesn't it? No, it's AHA LIVE to 22333. Now, I'm Nancy J, and I am your host today. And what we've been discussing this month for April is exercise. Now, this week, though, we're going to really move ourselves back into the doctor's office, as I was saying. So I'm sure many of us have stopped our checkups, those annual checkups and yearly exams in the doctor's office. But by postponing annual checkups, that's just not a good move. So it is time to take back your health. And that is why we call this show today, Doctor, It's Been Too Long. And this video is a perfect way to kick off our show. And of course, we want you to remember to hit the share button to let your friends and family know you're watching because they need to see this episode too. Also, throughout the show, we're going to ask you to get involved by answering a few viewer questions. And to respond, all you have to do is text AHA Live to 22333. We won't ask for your name or any personal information. If you don't want to text in, you can just participate by simply dropping your answer in the comments section. Okay, so with me this morning, finally, we're going to meet Dr. John M. Flack, Sergio Rabinovich Endowed Chair of Internal Medicine, Professor and Chair, Department of Medicine, Hypertension Section Chief, Southern Illinois University. Welcome, Dr. Flack.
Good morning.
Boy, with that kind of a title, you're going to be able to answer every single question we have today, okay?
I hope so.
I do believe you will be able to. And I'd like to get your thoughts on our first viewer response question. So here's the question. During the last 13 months, have you maintained any in-person doctor and dental appointments, yes or no? Okay, I will tell you, Dr. Flack, I have, but it took me a few months longer than I should have maybe waited.
Yeah, that's understandable, particularly early in the pandemic when there was a lot of panic and fear and things weren't as safe. Now a lot of people are vaccinated. The offices have figured out how to bring you in safely and have taken great precautions. So if you wear your mask, socially distance, and go to a doctor's office or dentist's office, they'll typically screen you before they even let you in for fever and COVID-like symptoms. I think going to the doctor's office is actually pretty safe.
Ah, well, that's good to know. And it looks like our viewers are also taking that recommendation because they said 75% of our viewers have maintained in-person doctor and dental appointments. So we got to talk more to those 25%,
yeah.
of course, that haven't been going. Dental, see, we forget about dental because, right. I mean, you're there and your mouth's open and, right?
Yeah.
It's important.
Yeah, slightly more people actually went to their dentist than to the doctor, which is interesting. But dental offices have the same precautions that doctors' offices do, at least the one I go to, and I think they're really safe.
Okay. Well, let's move on and get started with health in the headlines. Each week, we select one current headline that ties back to the topic at hand and to ask our expert to respond. So this week's entry comes to us from NPR, and it reads, 5 medical appointments you should stop putting off. Dr. Flack, can you fill in the blanks for us on this one?
Yeah, to me, I'd answer that one a bit differently. I would say it's hard for me to really recommend that there's any doctor's appointments you ought to put off. And so between office visits and telehealth, you should keep your appointments. And I don't necessarily know that there's a 5 per se, because I can't think of any that I would put off. Routine health monitoring, maintenance of care for chronic conditions, which is what a lot of people have, really just need to be taken care of. And finally, there are people who access the doctor's office because of certain symptoms they may be having, chest pains or problems swallowing. And for sure, those appointments should be kept with great diligence.
Well, and of course, the 5 were the cancer screenings, the prompt checkups for new red flag symptoms, follow-ups for chronic disease, mental health management, and also sexual health management. That's kind of like a
yeah, again, any health issue you have at this juncture, you should be accessing the health system and taking care of it, because don't want to send the message that, oh, those are the 5 that you do, and then forget everything else. I think there's very little that I'd say you put off at this juncture.
Ah, I like hearing that from you, Doctor. So let's get into our main segment with live viewer questions in You Ask, We Answer. As a reminder, you know that as we talk today, you can submit your questions in the comments section or submit them to heart.org/housecalls. So let's get to it. Our first question comes to us from Linda in Scarsdale, New York. Linda asks, is my doctor's office safe? How do we know it's safe? What can Linda do to keep safe? Dr. Flack?
Well, what Linda can do is, number one, mask. Wear your mask. When you get to the doctor's office, socially distance, and most offices are cordoned off in a way to keep you from sitting right next to people. Get your vaccination. And if you get your vaccination 2 weeks post getting fully vaccinated, your risk of catching the disease is going to be very low with most of the vaccines, and also transmitting is going to be very low. The vast majority of doctors' offices have fully adapted to the pandemic, the COVID pandemic, and have taken precautions to be safe, including screening people at the front door or even outside for temperature and for COVID-like symptoms. So I would make the strong assumption that your doctor's office is safe, and simply keep your appointments.
Ah, that's very, very good advice. So now let's check in with Cynthia in Newport. And she asks, I have diabetes, but I feel healthy. Is there any reason I shouldn't reschedule my appointment until it's safer?
Well, right now, I think the assumption that it's not safe is incorrect. The doctor's office is probably one of the safest places you can go. It's safer than going to the grocery store. It's safer than going to the pharmacy, certainly safer than going to a fitness club or restaurant, because doctors' offices take great precautions to adhere to guidance they've been given to keep you safe. And so if you mask, socially distance in the waiting room, and ultimately get your vaccination, going to the doctor's office should be routine. And even if you're not fully vaccinated yet, I would still say going to the doctor's office is one of the lower risk places you're going to go for picking up COVID infection.
Oh, I love hearing that. Thank you for that, Dr. Flack. Now, here's one from Julian in Plymouth. And this is just sort of your bottom line. Why is going to the doctor so important, Dr. Flack?
Well, going to the doctor is important because even in an information age where you can go to Google and you can search things and look at symptoms and drug side effects, etc. If you go to a good practitioner's office, the ability to sort through information, what you're telling them, and synthesize it and help you maintain your health, deal with your symptoms, get you to feeling better, and also to maintain your health over the long term, like managing your hypertension, diabetes, cholesterol, things like that. Those things are not well done by the individual simply going and doing searches. And so to me, those are the reasons it's really important to go to the doctor. Plus, there's testing that may need to be done that you're not going to necessarily be able to get done unless you do go to a doctor's office most of the time.
Does it make you crazy, Dr. Flack, that your patients come in with a Googled list of symptoms?
Well, it sometimes it leads to interesting conversations. And it's important to talk with patients and to understand what they're thinking, and then at times filter what they're telling you, and also give them the insight on how you're tying these things together, because sometimes it's very different than the way they have. But on the other hand, if the patient is engaged enough to go and look up things, I think that's a positive sign. Because they're taking some responsibility and are engaging in trying to ensure that they're healthy.
Okay, good. I think it's the pictures that always freak me out. I try not to look at those, right?
Yeah.
Okay, let's get to one more before we take a break. Maureen asks, Maureen says, I can't afford extra costs right now. Are there any options for me?
Yeah, there's a couple of things I'd recommend. One, look and try to figure out if your community has a federally qualified health center. They're often termed FQHCs. FQHCs will certainly see you and potentially can get you signed up if you don't have insurance, and are very economical. And two, check with doctors' offices and see if they take a broad range of insurances and the insurance that you have. And if there are issues of cost, check and see if they're willing to accommodate you with the payment plan. Those are the things that I would say would be the first two things I would do. And then telehealth, you're not going to get testing typically through a telehealth visit. Telehealth is also something that you can do as well.
And we're going to talk a little bit more about telehealth as we take a break for another poll question. And I want to hear from the audience. Grab your phone, get ready to text in your answer, because Dr. Flack has all the answers. And as a reminder, see, you're laughing. All you have to do is text AHA Live to 22333 to answer. And if you already have registered, you don't have to do a darn thing. You don't have to do it again. Or if you're just joining from your phone and it's easier for you, just drop your answer into the comments. Okay, so here is our question. Kind of just what Dr. Flack was talking about. During the past 13 months, did you make use of telehealth appointments, yes or no? So we want to hear from you, get your response. So, doctor, are these as good as, well, that's really not a fair question. Are they good if you can't get to the office, or are they just as good in some cases?
I would say that telehealth visits are a lot better than no visit at all. And telehealth visits, which you can do sometimes over the telephone only, or with an audio video connection across a smart device or computer, are pretty close to office visits. And I think for people who have multiple problems, telehealth visits are just a lot better than not doing anything. And this is a situation where I wouldn't let perfection be the enemy of the good. I'd say you're good and pretty close to an office visit. Obviously, there are things you can do in an office visit, like examine a patient, that you can't do over telehealth most of the time. But I would still say the telehealth visits are really close and are a lot better than not going to the doctor at all.
And it looks like actually 56% of our viewers did make use of telehealth appointments.
Mm-hmm.
I did not. I kind of waited and got to the doctor's office eventually. Maybe a couple of months late, but I got there. Okay, let's get back to more questions for Dr. Flack. Now, this next one is about telemedicine, and it's from George in Connecticut. How do I know if my doctor uses telehealth? Does every doctor use it?
Every doctor doesn't use it. Every office doesn't use it. Most health systems at least have some of their doctors using telehealth. And I think the easiest way is to just contact your doctor's office who you've seen or you want to see and ask them if they have it, and they can tell you right off the bat. In fact, whoever answers the phone can probably tell you.
And of course, we'd have to have the right equipment to get that telehealth.
Yeah, so the equipment for telehealth can be varied. It can be computers where you can do audio, video. It can be a telephone where essentially you do an audio only telehealth visit. And we do both here at Southern Illinois.
Okay, good. Well, Patty from Los Gatos wonders, it's been over a year since my last visit. So let's just say Patty apparently hasn't gone in person to the doctor. What kind of questions should I ask? Tell Patty.
Well, Patty, what I would recommend, particularly if you have any conditions you're under care for, is to really set up an appointment to go in and when you go in, ask for things about, is there anything we need to do for health maintenance? Is my blood pressure okay? Is there any lab work that I need? And even if you don't go in and you engage in a telehealth visit or even phone call to the doctor's office and ask a question, I'd ask those questions, and it's going to likely lure you into the office. But I think coming into the office now is infinitely safer than it was a couple of months into the pandemic.
Well, speaking of luring into the office, Olivia asks, how should I prioritize my visits?
I would say that any health visit that you need for taking care of symptoms, problems that have cropped up, health maintenance, or chronic disease management, you should make those visits. If there is a problem with executing those visits, the hospitals and doctors' offices will tell you. In the midst of the pandemic, for a while, elective surgeries were basically put off. But that's not something that you need to try to sort out. I would engage the health system, and I would prioritize all my appointments at the same level I did pre-pandemic, unless you get responses from places where you're seeking care that prevent that.
Well, and of course, a lot of it'll just be when a doctor can fit you in.
Absolutely.
Okay. Well, our final question today comes from Roberta. In general, I feel a bit down since I haven't been able to do the things that I normally like to do. And I've thought about talking to a professional, but I figure if I can't go to the gym, I probably shouldn't go to an appointment either. What should I do? What should Roberta do?
Well, again, I think going to the doctor's office is really safe and one of the safest places you're going to go outside of your home. Two, you're feeling down could be, one, you're just exercising less and not getting that high and uplifting your spirit that you get from exercise. Or two, it's possible that you may have developed some depression. So you could see a mental health professional or a primary care doctor to actually kind of sort this out over telehealth and work through that. So I'd encourage you to reach out to the healthcare system, but not equate that as going to the gym is not safe, so going to the doctor is not safe, because the doctor's office is a lot safer than the gym.
I agree with you on that one. And thank you, Dr. Flack, for motivating us to take control of our health now. And I'm sure you've convinced so many of us to make in-person doctor appointments. I've got some calls to make as soon as we're done, and that is a good thing. Is there anything else you'd like to add before leaving us today?
Keep your doctor's appointments, get vaccinated, wear masks, socially distance, and you're doing everything that you can do. Wash your hands. You're doing everything that you can do to help prevent the spread of COVID and bring this pandemic to an end. Also, really avoid closed, small areas like bars and restaurants that are packing in people. And again, I think that's about all you can do.
Dr. Flack, if you had to sum up how this pandemic has changed your practice, what do you say?
It's made me do a lot more telehealth. It's given me the opportunity to do a lot more. It has made me appreciate even more the barriers and obstacles that patients have, real and perceived, to making appointments, to coming to see you, coming to see us. And all right now, we probably do about 10-12% telehealth visits. At the peak of the pandemic, we were doing about 70 to 80% telehealth.
So I guess we have to be one of your patients to get telehealth with you, Dr. Flack, huh?
Hey, I can practice across state lines.
Okay. Thank you so much for your time and expertise. And of course, thank you to all healthcare professionals for being with us during all the time. That does it for our show today. Okay. That's it. I will be right here next week. Oh, we're going to tackle how to manage cholesterol. We probably haven't been eating as we should during the last year or so. And as always, you can find any of our previous shows at heart.org/housecalls. I hope you'll all heed Dr. Flack's advice. I'm going to look him up, don't you think? I think he sounds like he'd be a good one to do a telemedicine visit with. And you need to take care of yourself, as Dr. Flack advised. So remember, all we ask, wear a mask, watch your distance, and wash your hands. And of course, get vaccinated. I've got to call my doctor right now. Excuse me.
Getting back to this. To her. To family. To friends. To hugs. For people at higher risk of COVID-19 complications because of diabetes, high blood pressure, and heart conditions, the COVID-19 vaccine is an important choice. Consider it's the first step towards getting back to what you miss so much safely. Getting back to life. Set your heart on it. It's up to you. A message from the American Heart Association.
Learn more about House Calls, Real Docs, Real Talk